Hello everybody. We are going to talk about the very important system of the body that is known as the cardiovascular system, and I'm just going to give you an overview in this session. I'm not going to go into the very much micro details of the system and its components. It's basically a lecture for the beginners in anatomy. In a specific lecture, or in this video, I'm going to talk about the main components of the cardiovascular system, and then I will elaborate upon the blood vessels, the network of blood vessels in our body, and their types, their structure, their functions. And then in the next video, I'm going to elaborate upon the heart, its external features and the internal features. So let's start with the blood vessels. Here in front of you on the board, there is a sketch. It's a schematic drawing showing us the system in nutshell. So we have an organ which is responsible for receiving of blood and distribution of blood. And that is the pumping organ known as the heart or cardium. Okay? So here in the center, there is a heart sketched, and the heart is distinctly having 4 chambers. 2 chambers for receiving blood and 2 chambers for pumping it out. So the upper 2 chambers are the atria and the lower 2 chambers are the ventricles. Okay? So a right side of the heart and the left side of the heart. So why I am specifically mentioning about the right side of the heart and the left side, because we are going to discuss the blood vessels. So the components of blood vessels are basically rooting into the heart. Okay, so we have to keep in mind that the heart is distinctly divided into a right side and a left side. The right side is carrying deoxygenated blood and the left side is carrying oxygenated blood. Okay, now having said that, let's talk about the vessels. The network of the blood vessels which are present in our body are like very long tortuous pipelines. Okay, one type of vessel which is emerging from the heart, it is responsible for carrying the blood away from the heart. And by definition, that vessel is known as an artery. So the artery is a vessel or a pipe which is emerging from the heart, carrying blood away from the heart towards the body. Then we have another set of vessels which are basically bringing blood back towards the heart, or they are moving towards the heart, not away from heart. So these vessels are known as the veins. So the second component is a vein. Vein is a vessel which is bringing blood towards the heart. Then we have a third type of vessels which are very minute. They are almost invisible, microscopic vessels, and they are known as the capillary. So the capillary is located, it's not going anywhere. It is a breaking down product of the artery, and that is located within the tissue spaces. So a network of capillaries, like a fish net, is located within the tissue spaces. So here in the drawing, you can see the artery is emerging from the heart. It's being represented with fresh red color because it is bringing oxygenated blood, rich with nutrients, towards the tissue. So this region is the tissue space. Then the artery will break down into smaller vessels, and then ultimately the network of capillaries is there, which is located within the tissue space. Then after the supply of nutrients and oxygen has been done, the blood will receive the waste products from the tissue spaces and will be collected by the collecting tubes And the collecting tubes which are bringing blood back towards the heart are known as the veins. So here in blue, you can see the capillary bed or the tissue bed is being irrigated by an artery, has been drained by a vein. It's just a schematic drawing. We have millions of such spaces and we have trillions of such vessels. Okay? So the vein is bringing blood back towards the right side of the heart. So you can see the left side is being, oxygenated blood is being emerging from the left side of the heart, going towards the tissue spaces, supplying or irrigating the entire body. Then the deoxygenated dirty blood has been collected from the tissue spaces, has been collected by the veins and ultimately being dumped on the right side of the heart. Okay, this is a closed network, and the center of this network is the heart itself, the receiving and the pumping organ. Okay, now there is another set of vessels which are not, that set is not carrying blood in it. It is rather having a much clearer fluid in its lumen or in its cavity. These tubes are basically emerging from the walls of the veins during the embryonic life, and then they make connections and they form a distinct network which is running parallel to the veins, and the direction of flow in this will also be towards the heart. So this green colored network of vessels is known as the lymphatic vessel or lymphatic network. What is lymph? I'm going to talk in detail, but you have to remember that this is the tissue space. It's been irrigated by blood, has been drained off by the vein, and then also the remaining interstitial fluid, which is having many inflammatory cells and the other substances, has to be drained off because we cannot afford to have accumulation of fluid within the tissue spaces. So the tissue space has to be neat and clean. So the blood will be traveling in the vein towards the heart, while the lymph, which is a clear tissue fluid, will be traveling within the lymphatic vessels again towards the heart. Which side of the heart? Right side of the heart. So you have to remember that there is one set of vessels which is bringing blood towards the body, that is the artery, and two sets of vessels which are they are draining blood and fluid away from the body towards the heart. They are the veins and the lymphatics. Okay, now let's elaborate upon the anatomical structure of these vessels. So I'll take one by one. Let's start from this drawing. This is a basic drawing showing us the wall of a tube, a vessel. Okay, so I have like certain structures to be labeled, right? So this is the lumen or the center of the vessel, which is carrying blood or lymph or whatever. Okay, while the wall is thick, just like any other tube's wall, and it has been divided into segments, right? So it's been like, if this is a tube, it's been covered by layers, and these layers are like coats, and we call them tunics. Okay, so the outermost layer is known as the tunica adventitia. Then this purple central or core of the vessel wall is known as the tunica. Tunic means a coat. Tunica media. It's in the middle. Then we have the innermost coat or layer, which is in direct contact with the blood which is flowing within the lumen, or the fluid which is flowing within the lumen. So that layer is the innermost. So we call it the tunica intima. It's an intimate relation with blood. Okay? So we have three tunics. That is the basic configuration of a vascular wall. The tunica adventitia is the outermost, and it is linking the vessel with the outer surrounding structures. That is tunica adventitia. Then the middle layer, which is the tunica media, it's the thickest of all. And then the innermost layer, which is in direct contact with the fluid inside the vessel, is known as the tunica intima. Now, keeping this architecture in your mind, let's start classifying the vessels. So we'll take from the artery, because that is the first vessel emerging from the heart. Okay, so we have, when we talk about the arteries, there are three basic types of arteries being present in our body. The large arteries, which are also known as the elastic arteries, they are the largest arteries. And it's easy to imagine that those arteries are directly related to the heart. They are emerging from the heart. So the largest artery of the body is known as the aorta, which is emerging from the left ventricle of the heart. So it's one type of elastic artery. Then we have other examples of elastic arteries, like pulmonary arteries, which are going to serve, or they are going to supply blood to the lungs. Then we have the subclavian artery, which is taking blood towards the upper limb. The common carotid artery, which is irrigating the head and neck region. And like if we go down in the abdomen, we have the common iliac arteries, which are going to serve the lower limbs and the pelvis perineum. The mesenteric arteries. These are the large elastic arteries. Then we have the muscular arteries, the second type, or the medium-sized arteries. These medium-sized arteries are basically penetrating through the compartments of muscles. Like the best example of medium or muscular arteries would be the arteries which are irrigating the heart muscle itself, like the coronary arteries. Then we have the brachial artery, the radial ulnar arteries, the femoral artery, the mesenteric arteries. They are the medium-sized arteries. They are also known as the muscular arteries. Then we have the small arteries, which are less than, like either 2 millimeters or less than 2 millimeters in diameter. Okay, so the small arteries are almost at the tissue level, and they are either 2 millimeters in diameter or less than 2 millimeters most of the times. And arterioles, which we just have seen. So in the capillary bed, the capillary bed is being fed by a set of arterioles. And the arterioles are the smallest form of arteries. And these arterioles are basically, like, let me mention the diameter. So the arterioles are basically 20 to 100 micron. 20 to 100 microns in diameter will be the arterioles. Okay, and that is the end of the arterial chain. So we start from the elastic artery at the level of heart, then the muscular arteries at the peripheral level, then the smaller arteries just at the tissue level, and the arterioles, which are serving the capillary bed, and then that's the end of the arterial tree. Now, why we have labeled them as elastic, muscular, small arterioles? Why? Because if we keep this configuration, this architecture in our mind, there must be something different in the walls of these different types of arteries. That's why we have named them differently. Okay? Because their functions are different. Region-wise, the arteries they are performing different functions. So their responsibilities are different. That's why their walls configuration is also different. Like their structural architecture is different. So let's have a look first at the elastic arteries, which are the largest type of arteries. We have the tunica intima, just like the usual. Then we have the tunica media. Here you can see there's something some green color is also blended in that purple. That tunica media of the large arteries or the elastic arteries is having a very huge number of elastic fibers, strands of elastic tissue. Okay, so this green is representing the elastic fibers. In the large arteries, like for example, pulmonary artery, which is emerging from the right ventricle, or the aorta, which is emerging from the left ventricle, the elastic bands or fibers have been arranged so discreetly that they have actually produced two layers or two laminae. Okay, so you can see the tunica intima is represented as red, and then we have a layer of green tissue which is known as the internal elastic, because it's made out of elastic tissue, elastic lamina. Okay, a flat sheet. So the just outside the tunica intima in the large artery, there is arrangement of elastic tissue, and this elastic tissue, you can see, is interrupted. It is having pores or holes. This is known as internal elastic lamina. It's just lining the intima from outside. Okay, then we have the strands of a smooth muscle fibers. And I forgot to mention that tunica media is composed of, mainly in almost all the vessels, the media is composed of bands, concentrically arranged bands of smooth muscle cells. And the smooth muscle cells have the ability to contract as per the signal. Okay, so they are basically to monitor the caliber or the lumen size of the vessel. Okay, so we were talking about the elastic arteries. So the elastic arteries, the tunica media, is having a large number, a huge quantity of elastic fibers and the smooth muscle cells blended together. Then we have, you can see, the tunica media, and then outermost is the tunica adventitia. Between the tunica adventitia and tunica media, we have a continuous band or continuous layer of elastic tissue that we call the external elastic lamina. Okay, so we have an internal elastic lamina located between the tunica intima and tunica media. Then we have, and that this internal elastic lamina is having a lot of holes in it. And then we have the external elastic lamina situated between the tunica media and adventitia. This is the architecture of the walls of large or elastic arteries. Why do we have this kind of arrangement in the wall? Because these arteries are directly emerging from the heart, or they are lying very close to the heart, and they are bearing with the pressure through which the heart has pumped blood into these vessels, right? So that's why they act like balloons. Like you inflate a balloon, it is expanding because it has the elasticity in it. And then you deflate a balloon. So it will recoil. It will go back to its normal size. Okay? So the elastic arteries or the large arteries have this ability of, expanding and then contracting back to their normal size. So when you are, I want you to imagine when you blow air into the balloon gets inflated, and then the air, when you open up the balloon, the air will gush out with pressure towards outside, right? So that's how the aorta or the pulmonary artery or whatever the vessels which are receiving blood directly from the left ventricle are going to expand like balloons, and then they will contract. So they will push the air, or they will push the blood with pressure towards the structures which they are supposed to supply. Okay? All right. So the elastic arteries have the distinct external and internal elastic laminae, and the tunica media is in completely has a blend of smooth muscle cells as well as the elastic fibers. The tunica adventitia of these large vessels or these large arteries is having a lot of smaller arteries or smaller vessels. These are known as the Vasa Vasorum. The vessels of the vessels. Vasa Vasorum. They are coming from outside, external sources. So you can see that the thick wall of the elastic artery is like partly it's been supplied by, with nutrients and oxygen by the blood which is flowing inside the vessel, and partly it is being irrigated by these smaller vessels which are known as Vasa Vasorum. Okay, so the Vasa Vasorum are a feature of large arteries and large veins. Keep that in your mind. Then comes the second type of arteries which are present in our body. They are in majority. The elastic arteries or the large arteries are few in number. I just have named them to you, for you. But the muscular arteries or the medium-sized arteries are like 75 to 80% of our arteries are medium-sized arteries. Okay, they are going into different compartments of muscles. They are going to different organs. Okay, so here you can see the architecture of the wall of a muscular artery. You can see that there is an internal elastic lamina. Some elastic tissue or some elastic fibers are still present. There is intima. Then the media in this type of artery, the tunica media, is very, very distinct. It's thick, and it is composed of a whorl-like arrangement of smooth muscle cells. And these smooth muscle cells are innervated by sympathetic nerves, which are going to control the movement of these muscles. And that way they are going to control the lumen of the vessel, right? So the muscular arteries are basically controlling, due to their architecture, they are able to control the regional blood flow and the blood pressure which is present in that region, right? So they are basically playing a very important role. So you have to remember the medium-sized arteries are for regulating the blood pressure in like the regional flow of blood has been monitored by the medium-sized arteries. Okay, and they have a thicker tunica media. The ratio between the tunica media and tunica adventitia is like 3:1. Okay, then comes the smallest arteries, which are known as the arterioles. I haven't sketched the small arteries, but I have sketched an arteriole. So you can see the arteriole is basically doesn't have any elastic tissue. Okay, but it has a muscle, smooth muscle. Bands of the smooth muscles are wrapping around the tunica media. Tunica intima. So they are making the tunica media. The arteriole has a very thick tunica media and a very, very thin film of tunica adventitia. You can see there. And due to the large number of smooth muscle cells, the arterioles are considered to be the resistance vessels. They basically are the true resistance vessels. They are irrigating the capillary bed, and they are regulating the peripheral blood pressure. So you can say that if the arterioles stop functioning or they are malfunctioning, there will be fluctuation in the peripheral blood pressure. So the arterioles are the true resistance vessels. Okay. Then comes the veins, the vessels which are responsible for collecting blood from the tissue spaces and dumping it into the heart. Or they are the vessels which are moving towards the heart. Okay. So you can see that again tunica adventitia, media, intima is there, but less defined as compared to the arteries. So you just have to remember that the veins their walls are less organized as compared to the arteries. And that is why the veins they show changes as a person grows older, right? So they are they get dilated, and then the flow of blood is pretty slow in the veins in general as compared to the arteries. So their walls are they're not that thick. So here you can see that the tunica intima, first of all, let me also mention that the lumen of a vein, a medium-sized vein, is much larger than the lumen of the medium-sized artery. you can see over here. You can do the comparison. So the veins, their lumens are larger, they have an intima, and then they have a media which is not very well defined. They do have the smooth muscle strands, but not up to that like number as in the arterial walls. Then they have a thicker adventitia. The veins, the ratio of in the wall of a large vein, the ratio between the adventitia and media is, or media and adventitia is either 2:2 or 1:2. So the adventitia is thicker because the veins are pretty, like, they have a lot of blood flowing in them, because in general up to 60 to 65% of total blood is being present in the venous network in our body as compared to the arterial, right? So they are the flow of blood is slower in veins, so their walls are thinner, they don't have much elasticity, and they are collapsible. Okay, there's one feature which I just have mentioned in this drawing, and we call them venous valves. So the large veins, specifically the veins of the lower limb, they are known as the valve veins, right? These veins have these flaps present, or they are the extensions from the intima, tunica intima. You can see that these flaps are protruding towards the lumen of the vein, and what they are doing, they are actually closing the lumen. So once, like, just imagine the lower limbs, the heart has pumped blood towards the lower limb, the tissue exchange has been taking place. Now the blood is coming back towards the heart from the lower limbs. So it is moving against the gravity. So obviously the gravity is going to pull that blood down. What is happening? What is the role of these valves? It's really very important role, right? What they are doing, they are closing the lumen. As the blood has been pumped up towards the heart, it doesn't have the permission to flow down, flow back. So there is no retrograde flow of blood in large veins of the lower limb, right? They are constantly pushing blood up towards the heart and preventing the backflow of blood is being performed by the valves present in these veins. Okay, so the large veins, especially the veins of the lower limb, have in their tunica intima, there are flaps which are known as the venous valves, and they are responsible for the prevention of backflow or pooling of blood into the lower limbs. That's what happens when these valves, they get weaker, or sometimes they get damaged. There will be like in case of prolonged standing hours, we may feel that our leg veins are getting a little bit engorged, they are enlarged, because there is back pooling of blood into our veins of the lower limb, which is like common. But especially during last stages or last trimester of pregnancy, female might have noticed that their leg veins are engorged, they are enlarged, and we call them varicosities, the varicose veins, due to the malfunctioning of these valves. So they are not completely closing, so there is some trickling down of blood back into the lower limbs. Okay, so you just have to remember that there is no valve present in any artery, in any size artery. But there are valves present in the large veins, large and medium-sized veins, just to prevent the backflow of blood. Okay, the veins have larger lumen. They have walls which are thinner, much thinner than the arterial walls, and the architecture of the wall, like the arrangement of the tunics, is not very well defined in veins as compared to the arteries. Okay. Then comes the last vessel of the system, and that is known as the capillary. Here what I have done, I have sketched the cross-sectional diameter of a capillary. So you can see here the capillary doesn't have other tunics except for Tunica Media, except for the Tunica Intima. So you can see the capillary is lined with a single layer of squamous flat cells, and this squamous cells or the endothelium is known as the endothelium. So the endothelium, which is nothing but a single layer of flattened cells. And let me tell you one thing, that this endothelium is the main element of all the tunica intimas of all the vessels, like starting from the largest of arteries, the elastic arteries, the medium-sized arteries, the small arteries, the arterioles, the large veins, medium veins, venules, capillaries, lymphatic vessels. All of these vessels have a tunica intima, and the tunica intima is lined by this single layer of flattened squamous cells that are known as the endothelial cells, and the lining is itself known as the endothelium. It is a feature of the vascular system. It's a smooth, glistening membrane which is present within the lumen of all the vessels. All right, so come back to our topic. The capillary is having the tunica intima, the endothelium that is resting upon the basement membrane. The normal diameter of capillaries is ranging between 7 to 8 microns. This diameter is actually the diameter of a single red blood cell as well. So the capillaries are wide enough to accommodate the red blood cells. They are much smaller than the arterioles. The arterioles are 2200 microns in diameter, while the capillaries are 7 to 8 microns, but they are wide enough to accommodate the red blood cells. So what happens once the blood reaches the capillary level? I'll come back to my original schematic drawing. Once it reaches the capillary bed, within the capillary bed, the flow of blood is much slower. It's very slow. I would rather say dead slow. And that slowness will allow the exchange of materials to take place in the form of diffusion, in the form of filtration. So they are not the active transport mechanisms, they are passive transport mechanisms, and diffusion and filtration. And it is taking place at the level of capillary bed because the flow of blood is extremely slow. The diameter of the capillaries are much wider, and you can see because there is no thick wall present in the capillaries, so exchange of materials is absolutely easy. So that's why capillaries are generally known as the exchange vessels. Now we are almost done with the vascular system. So we are done with all these three components of the vascular system: the arteries, different types of arteries, their structure, the differences in their walls, their functions, then the veins. Then we did talk about the valves present in the veins, what are the functions of those valves, and then the capillaries. What is the difference between an arteriole and a capillary or venule? That the capillaries have like very small diameter, just appropriate for the size of the red blood cells to pass through. And the blood flow across the capillary bed is very slow. That allows the exchange of materials to take place within the tissue spaces. Okay, now we'll come to this last component of the vascular system. This itself is its own system, like lymphatic system. I'm not going to go into the details of the lymphatic systems, but I just am going to talk about the lymphatic vessels and the lymph. That also is not in like much detail. It's just that I want you to be aware that there is a parallelly running system present in our body that is like attached or associated with the vascular system. So when we talk about the lymphatic vessels, so lymphatic vessels are known as the lymphatic capillaries because they do not have the tunica media and adventitia just like capillaries. They are having just a narrow, not a narrow, but a wide lumen, just like a capillary. So there is a basement membrane, and on the basement membrane, the cells, which are flat and a single nucleus cells, they are located. They are resting on the basement membrane. This is a section or cut section through a lymphatic capillary, and you can see the difference. I haven't used the red color because the lymphatic vessels do not have red blood cells in them, right? So inside the capillary lumen, the lymph is flowing. What is the lymph? It is the tissue fluid or the interstitial fluid, and the composition of the lymph is, let me write it down. So the lymph basically is a whitish, transparent, roughly translucent fluid that doesn't have red blood cells in it, but the rest of the elements are pretty much the same. Like it contains water, it contains proteins, it contains fat. The white blood cells are a basic feature of the lymph, but not the red blood cells. And that is why the color of the lymph is whitish or translucent, transparent. It's not red in color, because our blood is red because of the presence of red blood cells, which contain hemoglobin. So minus the red blood cells, lymph is pretty much having the same composition as of blood. And it's the tissue fluid, so it carries a lot of debris within the tissue, like from the tissue, and also it depends upon the region from where the lymph has been drained. That fluid has been drained. So sometimes there is a concentration of, like, it's high in protein, sometimes it's high in fat. Like for example, in the intestinal tract, the lymphatic capillaries are loaded with fat molecules because they are absorbing the fat. So anyway, so what is happening? The lymphatic capillary is structurally, it resembles the blood capillary. The lymph is a clear fluid. It has a lot of protein, fat, glucose, amino acids, white blood cells, that includes macrophages, and sometimes it also contains cancer cells. Like in case of a spread of cancer, lymphatic system is playing a very important role, just like the venous system. So we'll talk about that pathology some other time. Right now, what we are supposed to know, that there is one difference in the lymphatic capillaries, that the capillaries of blood vessels, like the blood capillaries, do not have that feature. The lymphatic capillaries, so let me sketch a lymphatic capillary in front of you. So if I take a longitudinal section through a lymphatic vessel or capillary, it is something like this, right? It's a wide bored vessel, and the lymph is flowing, but it has, like the veins, the large veins, it has flap-like structures extending from its intima. And these are known as the lymphatic valves, right? These are known as the lymphatic valves. These flaps, they are like this. They are present in all the lymphatic vessels. These lymphatic valves are playing the same role as of the venous valves. So the lymph is flowing in the lymphatic capillaries, has been collected from the tissue spaces, and it is moving upward towards the heart, just as the venous blood is running towards the heart. So lymph is running towards the heart, towards the right side of the heart, and these valves, once the lymph has been pushed into the vessel, it is pushed against the gravity towards the heart. These valves, they close, they just get shut, and they completely prevent the backward or retrograde flow of lymph towards the tissue spaces. So it's pretty much the similar arrangement as in large veins. The lymph is a tissue fluid, as we have kept on mentioning, that it is present within the interstitial spaces. And our interstitial space is supposed to be pretty much dried off, clean, and in neat condition. So what happens that in case of damage to the lymphatic system, or in case of malfunctioning of the lymphatic capillaries, there will be accumulation of tissue fluid within the tissue. So that means there will be expansion of the tissue space because the lymphatic or the lymph is getting accumulated. It's not being, because there are blockades in the capillary system. So there is trickling back or a retrograde flow of the lymph back into the tissue spaces, or there is no drainage of lymph from the tissue spaces at all in case of damage to these capillaries, lymphatic capillaries. So what will happen? The tissue space will expand, and that condition is generally termed as edema. Okay? Accumulation of tissue fluid, accumulation of interstitial fluid within the interstitial or tissue space is known as the edema. So sometimes people do suffer from these conditions. There is like a abnormal functioning of the lymphatic system. Sometimes there is high blood pressure that will lead to edema. Sometimes there is blockade in the vascular network. So there are many situations in which people suffer from edema. But we basically, when we are talking about the lymphatic system, we are talking about lymphatic edema, so that it exclusively is present within the tissue spaces. Okay? So just to sum it up, what we have discussed today in this session, we just talked about this closed network which starts from the heart and ends at the heart. So we have the right and left heart. The right heart is having deoxygenated blood. The left heart is containing oxygenated blood. A vessel emerges from the left heart that is known as the aorta. It's the largest artery. So the arteries are the vessels which are the carriers of blood towards the body away from the heart. Then the arteries are having different sizes, they are performing different roles, and ultimately they break down into a capillary bed. The arterioles, the smallest arteries, they break or they irrigate the capillary bed, and the capillary bed is located within the tissue spaces. By tissue spaces, I mean every space, whether it's a space within the organ or it's the space within the muscular system. So the capillary bed is located within the tissue space. It's been irrigated by the arterioles, then it has been drained by small venules. The veins, the smallest veins are known as venules. So the venules will form medium-sized veins and ultimately large veins, and then the largest of all veins are known as the supia and infia vena cavae. They will be opening up into the right atrium of the heart. We will elaborate upon the vena cavae and we will talk about the heart in the next lecture, but right now you just have to understand that this is a closed circuit, and if anything goes wrong within this circuit, there is a blockade that will lead to the backward accumulation, or there will be a blockade in the distribution. So we have to just keep in mind that our vascular system is just like a network of pipelines, right? Then adjacent or running parallel to the vascular system, we have the lymphatic system, or there is a network of lymphatic vessels which are they are sprouting out from the embryonically, developmentally, they sprout out from the walls of the veins, large veins. So they are much closer to the venous network. And both veins and the lymphatic capillaries having the flow of blood and fluid towards the heart. So lymphatic vessels, they collect the extracellular interstitial fluid from the tissue spaces and will ultimately dump that tissue fluid within the subclavian vein or the right atrium of the heart. As per the age, the arteries, the walls of the arteries, especially the large arteries or the elastic arteries, they start showing changes, age-related changes. So what happens in general, within our body, there is less production of collagen and less production of elastin and other, connective tissue fibers. So the same thing will happen with old age. These large arteries, the tunica media of these large arteries will start losing the elastic tissue. And that will lead to hardening, either hardening or like in the vessels, the large arteries will become inflexible. They will not be freely contracting and relaxing. They will get a little bit harder and will lose that flexibility. So that is pretty much normal. That is an age-related change. So you usually do not count it as a pathology, right? So basic changes related to age will happen within the tunica media, not in the intima or adventitia. Okay. The other thing about the tunica media and the adventitia of the veins. Veins usually are like, generally there is a set of superficial veins in our body. So their arteries are always deep. They are deeply placed, while the veins, they are like there basically are two sets of veins, especially in the limbs. We have a deep set of veins which are lying or they are running along with the arteries, and then there is a superficial set of veins. So the veins basically have a thicker adventitia, but their tunica media is not that well organized. So generally what happens that they are susceptible to get the infiltrations from the surroundings. Like for example, in a case of tumor, the tumor can erode through the wall of a vein much easily as compared to through the wall of an artery. So the arteries usually do not get the seedlings of tumor or cancer, while the veins, they get affected. And the other thing is like there is, because of the thin tunica media or a generally thin wall of the vein will lead to stasis of blood at times, because there is not much ability in a vein to push blood towards the heart. The elastic tissue is much less in quantity within the tunica media of the vein as compared to the arteries. So there are more chances of blood stasis within the veins as compared to the arteries. So these were the few features I wanted to discuss with you that they do happen as per age, and they are physiological changes. They are physiological phenomena, and nothing wrong about these things. Thank you very much, and then we will discuss the heart in the next session.